Someone that maybe is kind of starting to show symptoms of menopause, what would those initial symptoms look like?
I actually hear about so many other symptoms that they are not perhaps documented in literature yet, but I'm always very, very interested in hearing about what women have to say, because we're still learning.
I'm Megan Ferguson. Welcome to Patient in the Room. I'm joined by Dr Theodora, a BMS Menopause Specialist. Dr Theodora, welcome.
Oh, thank you.
You've had such a rich and varied career from health management to clinical practice. What kind of first inspired you to kind of work in women's health and menopause care?
Well, it goes back many, many years, I'm afraid. When I was a medical student, I saw my mother suffering from debilitating symptoms at the time. And she was a very busy professional, running a business, running a family. And I was in medical school, more or less at the end of, and I felt I didn't really know what was going on and I didn't have the knowledge how to help her. And in those days, there was a little bit of whispering about the symptoms, and women had to suffer in silence. There wasn't really much help. There wasn't really any discussion. And I felt surely there must be more to it. And that was the beginning of my journey in menopause care.
And what kind of changes within menopause care have you seen kind of since your early career to now?
Oh, huge changes. I don't know how much time we have, but from not talking about it at all to having very loud voices nowadays, from having some treatments available to having more choices, more options, having more evidence in our hands, more tools. It's been fantastic. Of course, there's much more that can be done, but definitely we are in a better place nowadays compared to my medical student days.
And I guess like for many women, menopause can be a really confusing and frightening time in their life. Could you explain what's actually happening to your body when you go through menopause or perimenopause?
Well, it's very interesting, and you use the terms menopause and perimenopause, which can be a little bit confusing still for a lot of people. And we usually, just for simplicity, use the term menopause. But perimenopause is the early stage, is the beginning of the transition, of the changes that happen in the body. Whereas menopause is just one moment in time where the natural periods stop permanently, forever. And there is a distinct, sometimes, difference between the two, because usually in the perimenopause you have a lot of changes in the female hormones. There can be a lot of ups and downs, highs and lows. We call them fluctuations, variability. And these can be a very, very a common trigger for a lot of symptoms. Whereas after the menopause stage, you more or less, if I can use it simply, have a flat line of the female hormones. So you are against the very low levels, as opposed to the perimenopause, when the levels can be very chaotic, in addition to having very low levels at times. So it's the combination of two that can be a trigger for a lot of symptoms, whereas after the menopause, you usually have these very, very low levels, and how they can affect your body and the different parts of the body, then they will present with different symptoms. But that is where it can be quite exciting and challenging sometimes to manage the two different stages.
And you touch on female hormones. Could you describe what those are or name them for me?
Well, I will say very simply there are mainly three types of hormones. One is what is commonly known as estrogen. And estrogen is plural because we have more than one type of estrogen in our body. But our ovaries produce a type of estrogen called estradiol, which is the one that tends to fluctuate or go very low and can be the trigger for a lot of symptoms. Then the other main hormone, female hormone, is progesterone. And again, that's a very interesting hormone and can help us in different ways, but usually it's there to create the cycles, the menstrual cycles. And then you have another hormone, which, although we call it female, it's not unique to us only. It's the testosterone, which both men and women have. But it is also considered a female hormone. So it's a very exciting hormone. Perhaps we can talk about it if we have time today.
Yeah, and so touching on that, I had no idea that women had testosterone. What is the role of testosterone in the female body?
Oh, that's $1 million question because there is so much discussion about testosterone, and it's a hormone that is very, very exciting, very interesting, and it's a hormone that hasn't been studied very much, though, in women in the way that it deserves to be studied, although there is more interest as we speak nowadays. So testosterone is a helpful hormone in different ways. Very much is associated with libido, but not only with that. We know that it can help our musculoskeletal system. We know very well it's a known hormone that is banned for athletes because it can create more muscle. It can be used to enhance kind of like body mass and strength and other attributes. And we know that it can have an effect on many aspects of our body, and whether that is in a physical way, whether it's emotional symptoms. We know about aggression. Apologies to the men who are listening to this, but it is more linked to perhaps heightened emotions in terms of anxiety and aggression. But at the same time, it can be linked with cognitive function, perhaps the very commonly known brain fog or memory or concentration. So there are many attributes that can be linked to testosterone, although not proven scientifically in the way that we would like to. But we know there's a lot of observation about how good the testosterone can be for our body in different ways. But so far, the main indication when we talk about testosterone is around sexual desire and libido. So that's the main area where we concentrate our discussions. And of course, anecdotally, we can talk about the other potential benefits.
Awesome. And then I guess so progesterone regulates your cycle. That's kind of like the use of that in the body. And we touched on estrogen as well. What role does estrogen play within a woman's body?
Well, generally speaking, I would say that our body has female hormone receptors, including the estrogen, progesterone, testosterone, almost in every part. So when we look at our body composition, whether it's the brain, whether it's our bones, our muscles, our joints, our skin, our hair, our gut, our blood vessels, they all have hormone receptors. Now, they're not all responding the same, and biologically, we're all very different in how these hormones affect us in the different functions. But what is interesting is particularly with estrogen, we know that there is an effect in almost every part of our body, and that's why we can have a variety of symptoms that can happen when these levels aren't quite right, which include, as I said, a cluster of whether it's physical symptoms, emotional changes, cognitive changes. So a very, very wide range of how these hormones can affect us.
And so someone that maybe is kind of starting to show symptoms of menopause, what would those initial symptoms look like?
Well, it's interesting because a lot of people associate the symptoms of the menopause with the famous hot flashes and night sweats.
Yeah.
And yes, they are common, but they're not the only ones. As I mentioned before, there can be so many symptoms from different parts of our body. And in literature, there's been a reference to at least 50 symptoms. But in my day-to-day practice, I actually hear about so many other symptoms that they are not perhaps documented in literature yet. But I'm always very, very interested in hearing about what women have to say because we're still learning.
Yeah.
We learn the things that they're not known either through research or it's still a blind spot in our knowledge. So other symptoms that can be linked to hormonal changes could be palpitations, changes of our heart rate or how we perceive that our heart rate is like, or headaches. There can be more joint pains, which is something very, very common.
Yeah.
There can be changes in our emotional state, anxiety, low mood, depression. There can be changes in our cognitive function, the famous brain fog, memory changes. If I can run a clinic just talking about memory, that could be all day really discussion about how common that kind of symptom is in day-to-day life when somebody says, oh, I forget words or I forgot what I went into the room to do,
Yeah.
or where I put something. Or even worse, sometimes people say to me that I saw a film the other day and 2 weeks later, I couldn't remember I had watched that film. And my friend reminded me of that. So it can be really a significant effect on different functions. And other parts of our body, our bladder, our sexual function, can be also very much affected. So quite a spread of symptoms.
It kind of sounds like it affects almost every part of your body and your life, actually. I'd love to talk about HRT, hormone replacement therapy. What is HRT?
I think you said it very well. HRT stands for Hormone Replacement Therapy. And what I simply tell my patients and when I talk about HRT is that this is exactly what it is. We replace the hormones that they're not quite in the same way released by the ovaries. So it's not putting much more in the body than it has been used to. I give an analogy to a lot of women who perhaps have tried the contraceptive pill in their life, that this is a very different preparation in terms of composition, how the chemical nature of the hormones we use with HRT tend to be more close to the chemical nature of our own hormones. You may have heard the term bioidentical or body identical. So this is more like the natural hormones. And then, of course, the amount and the dose that we give through HRT is very different to, let's say, the contraceptive pill dose, which is much, much higher, stronger. So we truly try to replace what the body is not doing consistently in the same way every month. That's what it is.
Fascinating. And I guess like you kind of related it to the contraceptive pill there. So why is the contraceptive pill, that kind of like injection of hormone, higher than you would get for hormone replacement therapy for the use in menopause?
Well, it's a very good question. And the simple answer is because they have a very different function. The role of the contraceptive pill is to minimize, reduce as much as possible the risk of becoming pregnant.
Yeah.
So the role is to override the function of the ovaries, which is the release of the egg and allow it to be fertilized. So the purpose there is to stop that from happening. Whereas the hormone replacement is there to really, in a way, top up what the body's not doing consistently as it has been doing, and it's causing symptoms. So very different functions there.
And I guess like I've kind of heard like a lot of conflicting information in the media around hormone replacement therapy. How do you help your patients make an informed choice whether that's right for them?
Well, you're absolutely right. This is it can be mind-blowing. There's a lot of information out there, some of which can be very misleading, can be misinterpreted, or can be based on old kind of knowledge and research. And of course, you mentioned at the beginning, there could be a lot of myths and misconceptions. So our role, as we see it in our practice, is to offer, first of all, what we know so far through evidence. It's the evidence-based approach. It's share with individual what we know through research so far. And then through our own experience and expertise, is to offer what we see happening in practice as well. And of course, there's the third element, because, as I mentioned before, there's still a lot to learn, and there's a lot of room to run more research and more looking deeper into these areas. And what is interesting is when we meet in scientific meetings, whether it's within the UK, in Europe, internationally, is to share the knowledge and the experience from our colleagues and really learn from each other. And there is a phrase that has been used more recently in different scientific meetings. So from one side, we have the research, what the evidence shows, and then we say, in the real world, this is what we see happening. So it's really putting the two together and trying to make sense and give individuals information and what options are available and what we know so far, because obviously things may be changing over time.
And for those that kind of decide that HRT is not right for them, what other options are out there for them?
Well, again, as you said, there are many examples where the HRT may not be the appropriate option.
Mm-hmm.
They may not want to have it, or they may not be clinically suitable to have HRT.
Mm-hmm.
And the good news is that, yes, there are many options, and they can either be medical options, I would call them, so that means other medications that they are not hormones, but they can help manage the symptoms. So it's all about symptom management and looking at the different ways that can happen. So there is a big menu of tools we have in our box, which is great. So as clinicians, we can offer other treatments, but we can also look into non-medical options, so alternative treatments. We can talk about other approaches such as, let's say, hypnotherapy, which has become quite interesting in recent years. Or we can look into cognitive behavioral therapy, which more and more has been shown to be a very effective way of managing a lot of symptoms, including physical symptoms like hot flashes and sweats. Or we can look into supplements, and there is really a plethora of supplements available, and one needs to be mindful that not all supplements can be appropriate, but some may have a role to help with the management of symptoms. And last but not least, it's also about looking at lifestyle. Lifestyle choices, habits we have on a daily basis, and there can be sometimes a lot of room for improvement there, which can have a significant effect on a lot of symptoms.
I guess I've heard you kind of talk about a holistic approach to menopause. So, you know, not just taking in the kind of like what's happening in the body, but also taking in the whole person. So I guess like what you were saying there, does that kind of encompass that holistic approach? So, you know, maybe HRT is not right for them, but looking at their lifestyle and other things like that, and CBT therapy, things like that.
Well, this is the cornerstone. It's looking at the person as a whole.
Yeah.
I heard a colleague some time ago saying to me that, oh, we manage symptoms. And I felt that was not really the approach we have in our practice. No, we don't manage symptoms. We help the individual. We support the person as a whole, because that person is at the center of everything. It's not me who will take the decision on behalf of you. It will be you looking at what I'm giving you as tools and options and what feels right, because it's not only about what, let's say, the evidence says or what I think is good for you, but you may have your for good reason, very strong beliefs as to what you want to take into your body or what approach you may want to adopt. And our role is to guide you and support you in that and really offer you facts, knowledge, expertise, experience. So it is very important to see the person as a whole, look at the beliefs, look at the different options, and really work together. What is right for you at that moment in time? And obviously in a way that we believe it's safe for you.
Yeah. And how closely linked are sleep and hormonal health?
I should have mentioned about sleep earlier on, because it's one of the most common complaints that a lot of women have when they start experiencing, I would use, as I say loosely, the word menopause, whether it's perimenopause or after. Sleep problems are very, very common, and there can be a lot of factors. It's one of those, let's say, symptoms or situations where you really need to look at everything that can trigger, contribute, and affect the quality of sleep. So hormonal changes play a part. It's interesting because all three types of hormones I mentioned earlier on, the estrogen, progesterone, and testosterone, can have an effect on our sleep, whether it's the pattern of sleep during the night, the length, the quality. They all have the kind of role in how they affect us. So it's interesting when we have discussions to explain that they could be a response when we look at the combination of the different hormones, but it's also understanding what else has been happening, because there could be other medical causes or triggers. There could be external stresses, other factors. There could be lifestyle choices. For example, something that a lot of people don't know is that alcohol can be a stimulant. It's very common that we may have a glass of wine or two, perhaps, at night time, and it makes you feel more relaxed. It may make you feel drowsy. And it's actually a stimulant, and it can affect and disrupt your sleep. So things like that are very, very helpful to discuss, and not to only concentrate on the hormones, but of course understand there is a role there and talk about it.
And I guess, like, why is it so important that we are talking about menopause in society, in, you know, workplaces, in everyday life?
Well, menopause will affect us all, whether we are women of any age, and it's not something that relates to women of a certain age, because it can happen at any age. Yes, we know that it affects more women, let's say from the age of 45 to 59. That's the perimenopausal journey and transition. But of course, you can have much earlier presentation. Our youngest patient in the clinic is 22 years old.
Wow.
And our oldest is 87. So it's something that can affect, as I say, any woman at any age. But at the same time, it affects men, whether it's because of the partner, daughter, mother, colleague, employee. There will be a time in the life where they will come across somebody who has been troubled by debilitating symptoms. And it's about understanding that. Or even if it's mild changes. Again, it's part of the understanding and respecting that this is a transition that happens, and it's about being part of this supportive environment that we need to create for women. And you mentioned workplace. It's an area that we are very passionate in our clinic about, the effect of the menopause in the workplace. We see a lot of women at different stages in their career, different roles, and they share their stories, how much symptoms may have affected or are affecting the work performance or the way they think about continuing with the work and their career. So we see women who may decide to change jobs and go part-time when they wouldn't normally do that, or they may decide to take early retirement, or even quit a job completely and say, I can't do this anymore. Even worse is when you have situations where they go under performance management because the symptoms have affected them in the way they have been able to or not able to perhaps deliver the usual expectations or work commitments. And then, unfortunately, it is misunderstood as a performance issue rather than a medical situation that could be rectified in a different way and could be supported effectively through other routes. So taking a woman through a performance kind of like route, and we have had even examples of women being dismissed, and then it can be a very, very difficult situation, both for employers, obviously, and the person who's going through that or who has gone through that. On a few occasions, we had to provide reports to help and support the individual with a good outcome in the end. So there can be so many different scenarios how women get symptoms to affect them in the workplace. And it's very important for organizations to be aware so that they don't lose talent, they don't lose significant part of the workforce, and also for the individual who has built a career or wants to build a career, and they feel that some changes in the body, which seem to be beyond their control to start with, can take control over them rather than what they aspire to do, what they want to do, and stop that trajectory very prematurely. It's not fair.
Yeah, I mean, it's fascinating. what can we do to kind of start having these conversations in the workplace? And, you know, is there any kind of thing that we should be asking our workplaces to put in place if someone is going on this journey?
Well, it's an area that thankfully there has been much more interest and there's been more awareness. So the key word is awareness.
Yeah.
Let's talk about it. Let's be open about it. Let's not see it as a taboo, although it's still a taboo in some places, in a lot of places, many more than perhaps we would like to admit. But definitely where we are nowadays is a much better place compared to even 8 years ago. So it's having the dialogue, whether it's through simple awareness sessions, and we do a lot of talks to organizations just to really mention the basics. They can be training for line managers to understand how to perhaps discuss these situations, or if they have, whether it's a concern or whether they think there might be some changes going on which may relate to menopause changes. How do they start that conversation without feeling that, it's going to be very embarrassing or very difficult, or I don't know how to tackle that. So that's one way. And of course, on the other hand, there can be policies that organizations can put together to make it more formalized, and some already have done very good work in that area, or having menopause ambassadors, as they call them, or have menopause support groups within the work environment. So there can be a lot of different ways where organizations can offer support, can offer help, from just having an awareness session or discussion, or more formalized policies, or even offer access to medical care, which some organizations do. It depends on the size, it depends on the mix of the organization, and also the culture of the organization. But we need to work on changing the culture to be more supportive to the female workforce.
Absolutely. And how do you have any tips for women as to how they can advocate for themselves?
Well, again, there can be a lot of different ways, and it's interesting because when you have been through a journey where you felt, that was terrible, horrible, debilitating, to coming at the other end of the tunnel where you've said, no, I'm back to my normal self again, or even better, then you want to talk about it. So there are a lot of women who, after having had appropriate support and help, they are the ones who will go out there in the workplace and say, we need to do some work here. And I'm willing to start, whether it's putting a group together or being, let's say, a menopause ambassador, or having a menopause cafe, or anything that they think is going to work a little better and start the change in their organization can be very, very positive. And we see that kind of movement more and more nowadays, with a lot of organizations and women taking the lead.
And for those that maybe are starting to kind of show symptoms or experience symptoms, but they're feeling a little bit lost and just not sure where to go, where could they go for that kind of like first step in their journey? Is it their GP? Should they go and see a specialist? Should they talk to other women around them that might have experienced this?
Well, again, I would say in a way all of the above, and depending on how the individual feels like and how ready you are to start talking about what is going on. But it's interesting that a lot of the times, as women, and I don't want to sound sexist here, but we tend to put up with a lot of difficulties we may go through. So it's not unusual, somebody telling me that, this has been going on for a year or two. We're not talking about a few days or a few months. And a lot of the times there can be other factors that we think that have been the triggers for the changes, for our symptoms. Of course, for a lot of women, because these changes tend to happen, let's say, at a time in our life when there can be a family, we are further up in our career, we may have elderly parents, challenges in relationships. So it's a little bit like a perfect storm kind of time in our life. And we feel, of course, I'm so busy with work, or I have the children, or I have my parents, or I have other kind of like triggers that they attribute the kind of experience of these new symptoms. So they delay asking for help. But of course, for me, coming from a background of being a GP in one of my previous lives, I would say, yes, speak to your healthcare professional, that you feel comfortable and you approach and have a discussion about your concerns. There's more and more awareness that has been taking place over the last few years about the menopause. And if in doubt, if there's still confusion, I would say reach out to a specialist, to a true menopause specialist. And I say that true because a lot of practitioners want to name themselves a specialist when they haven't really had the relevant appropriate training. So it's good to look at reputable sites. I know we use a lot of information. We look at YouTube, we look at different kind of like videos, celebrities talking about their experience. It can help, but it can also confuse, and it can give different kind of like versions of what is actually true and valid. So looking at the British Menopause Society website, it has a patient arm page and site which is tailored for the public. So in good, simple language, can give a lot of information which is factual and scientific, but at the same time in a more user-friendly way of presenting it. So looking at that to start with as a starting point, for me would be the main go-to place, because it is the professional body that is responsible for training, education, guidelines, quality, and really the leading body in the UK on menopause care. And it also lists all the menopause specialists who have been trained properly. And it's very easy, very transparent to find out through the website.
Perfect. And so before we finish, I've got just a few quick-fire questions, short answers only. So a common menopause myth that you'd love to bust?
You should stop taking HRT at the age of 60. How many times have I heard that? How many women have I seen when they say, oh, my doctor doesn't want to prescribe anymore because I'm reaching 60?
Interesting.
Yes.
One small lifestyle habit that makes a massive difference?
I didn't mention that before, and it is alcohol.
Okay, so having or not having?
A very good question, especially as we are in the evening time. Definitely not having, or with measure.
Yeah. And a quote or mantra that you live by?
Oh, you cannot predict the future, but you can create it.
Amazing. That's a really good quote. I like that.
That's what made me start my clinic.
Ah, fascinating. Well, Dr. Theodora, it's been absolutely lovely having you on The Patient in the Room. And yeah, I thought that was a really interesting, in-depth conversation around menopause.
Thank you very much.
Thank you. If you enjoyed today's episode, please follow and share Patient in the Room wherever you get your podcasts. We'll be back soon with more conversations.